The WHO has declared the public health emergency of international concern over. So although that means the emergency is over, it doesn't mean that Mpox has gone away. It is still here. It is still circulating at low levels at the moment in Europe, but with the potential for flare-ups.
I think we've learned a huge amount over the last year of Mpox, and unfortunately, what I don't want us to do is to lose that learning when and not if the next infectious disease comes around the corner that impacts upon our communities.
Now that we have managed to explicitly include the trans community within the different medical guidelines and the different toolboxes that are offered by, among others, the WHO, our main focus is to secure that the trans communities, especially the further marginalized members of the trans communities, meaning trans sex workers, trans migrants, Black, Indigenous, and other trans people of color, trans feminine people, that all of these communities have access to testing, to vaccination.
And it's also important that health authorities continue to have a health workforce who are aware of Mpox and what the signs are.
Let's talk all about the future. So summer's coming up, you've got this new classification, you've got this new campaign. What's happening? What's the thoughts going forward to summer, and what can people do? What should they be looking out for? How should they be taking care?
So one of the things that we will be doing now is to reach out to the ballroom community, where we will be having an event this weekend, where I will be, among other things, judging and walking and presenting some of the work that the WHO and that the GU is doing, but also just making it accessible for people, telling people where they can go, what they can use, sharing with them a little bit of the information that the WHO has prepared.
We need to make sure that our community organisations and our voluntary sector organisations are properly equipped and properly resourced to be able to step up to the next response when we're asked to do so. We're going to really start ramping up our policy pushing, our advocacy. There are now rumblings that we're starting to see numbers of cases start to increase, a flare-up.
My recommendation goes to the decision makers. As for the communities, well, we're already very well organized and we're already well informed thanks to the WHO. So now we just need to have access to treatment and vaccination and testing.
I'll speak for myself as someone who went through Mpox. I really love that this is happening and that we're able to have this conversation and more people are being included. But I think actioning change from above and from the bodies that can actually impact this change. And I think it's really important that we all work together. And I love that the WHO is really fighting for this. I think it's amazing, but we do need to make sure we're pushing policy making.